This is St. Louis on the Air from St. Louis Public Radio. I'm Elaine Cha. 10 years ago this month, the landmark health report For the Sake of All was jointly published by Washington University and St. Louis University. The 80-page document highlighted health inequities in the St. Louis region and focused explicitly on disparities in outcomes for Black community members. And its most striking, most frequently cited finding was an 18-year difference in life expectancy between two zip codes separated by less than 10 miles. That and other data in the report was eye-opening to some and affirming to others. In the months after its release, there was a great deal of conversation about issues of racial inequity around health, education, and economics. But 10 years later, what's changed and what is happening now? Dr. Jason Purnell was lead author of For the Sake of All, and today he's the president of the James S. McDonnell Foundation, and he joins us now to discuss those questions. Jason, welcome back to St. Louis on the Air.
It's a pleasure to be here. Thank you, Elaine.
Jason, take us back to the beginning of how For the Sake of All came about. What about the St. Louis region so struck you and your team that you decided to conduct research about health disparities in the first place?
Well, it was really a group of mostly young faculty, junior faculty, who were getting together informally for lunch. So the entire team included myself, Daryl Hudson, Bettina Drake, and Melody Goodman, as well as probably the most senior member, Bill Tate, who's now the president of LSU on the WashU side, and Keith Elder and Keon Gilbert from SLU. And I wish I could tell you that the origin story was some great epiphany moment, but it was really just a curiosity. We were all doing health or health-related work and wanted to see what did the data look like in St. Louis, but not just tell the same story about health disparities. Black people have higher cardiovascular disease or hypertension, but what were the factors? What were the issues that were driving those disparities, and what did that look like in St. Louis?
So there were power lunches then, basically.
You could say that.
So For the Sake of All, it looks specifically at health and well-being of Black St. Louisans. And you're talking about, there's information that everybody knew, but insofar as the factors went, there wasn't as much going on with that. Why not?
Well, 10 years ago, topics like the social determinants of health were not flying off of everyone's tongues, even though people in public health were quite aware for some time that there were these social factors like education, like income, like the quality of neighborhoods that were driving health outcomes. But when most people thought about health, they thought about health care. And it turns out health care only accounts for 10 to 20% of health outcomes. It's really about the context in which people live. And that was the story that we wanted to tell, but we wanted to tell it in an accessible way, ways that people could understand and ways that were relevant for St. Louis.
Mm-hmm. And that actually brings me to this question about social determinants of health. Just over the last couple of weeks, we talked with folks from SSM Health, and they will be conducting a community health needs assessment. And as you said, social determinants of health is something that people now say with much more familiarity. Was it really like a big thing in public health that just sort of needed a moment to be better understood, or even, for lack of a better way of putting it, to be publicized?
I think in the certainly in the popular imagination, it needed more attention. I think in academic circles, there was growing awareness that these social and even cultural and political factors were key to driving health outcomes. But the general public was not as aware of, the fact that there's a 15-year gap between the life expectancy of the highest 1% in income versus the lowest 1% income for men, and a 10-year gap for women. And more than likely, that gap has widened post-COVID, and we've seen overall life expectancy drop. We're probably one of the only advanced economies where we've seen a decline as precipitous as ours has been in the United States. And this can't just be explained by people's access to health care.
Mm-hmm. So given those circumstances, particularly with COVID, I mean, did COVID then do something to help people better understand what social determinants of health are?
I think for some people it did. We saw with clarity that the people that we belatedly called essential workers,
right,
we didn't treat them as essential prior to the pandemic, that they were at greater risk because they were interacting with the public and had less choice and less ability to isolate themselves, to stay at home, to work remotely. So people saw in real time that there was real peril to having lower income, lower status job, a job that you didn't have the same flexibility.
Mm-hmm.
And that put some of those social determinants front and center for people.
Mm-hmm. One of the things that I think is really important to talk about right off the top is the timing of For the Sake of All. So I moved to the St. Louis area in June of 2014, and this was just a month after For the Sake of All came out. I'm reading about social determinants of health, and we were also talking about that 18-year life expectancy gap. Within 3 months of the report's release, Michael Brown Jr., who was 18 and a recent graduate of Normandy High School, was fatally shot by Ferguson police officer Darren Wilson. Dr. Purnell, to what extent did Brown's untimely death make the research findings of the report more relevant to the public or to other institutions?
There's no question that the murder of Michael Brown elevated the discussion, and really people internationally. I was on the phone with folks from South Korea, Brazil, Canada, trying to understand what was happening in St. Louis and using For the Sake of All as one of the things they used to decode the unrest that was happening in the streets. Where did this frustration come from? Where is this anger coming from? And how are these inequities playing out in St. Louis? And I tell people when the governor's appointed Ferguson Commission had its first meeting, they had copies of For the Sake of All in front of them. Each commissioner did. So it became a tool for trying to understand inequity and the complexities and the history and the legacy of things like residential segregation, the ways that shapes economic opportunity in the region, and the ways in which that not only drives health outcomes, but all kinds of life outcomes.
Mm-hmm. How did that feel for you and the other members of the research team who put the report together for it literally not to be sitting on a shelf, but in front of those who are on the commission?
Well, obviously, it was important to provide context. I provided testimony to the Ferguson Commission. I actually toyed with the idea of putting my name up to be a member of the Ferguson Commission, but decided we had work to do because there was a second phase of the For the Sake of All project, which was about really informing, educating, mobilizing the community. So we had community discussion guides and action toolkits and community action forums where we brought in community members, we brought in experts, we brought in residents to talk about the 6 areas of recommendation of For the Sake of All, and further and deepen the conversation around the findings of that report.
Mm-hmm. We're speaking with Dr. Jason Purnell, who's the lead author of For the Sake of All. Today, he is the president of the James S. McDonnell Foundation. And we're talking because this is the 10-year anniversary month of the release of the For Sake of All report that highlighted disparities in health outcomes for St. Louisans who are Black. Jason, the community work that you did that was part of that phase 2 of the report, you went onto a new job. And this was in the midst of the pandemic, just as it was ending. And it was specifically about community. Tell us about the connection between For the Sake of All and what you ended up doing at BJC Health.
It's a very interesting story, and it's an example of the impact that the report had and continues to have. The leadership at BJC was thinking about the ways in which it needed to change its approach to supporting the health of the community, and to its credit, created an Office of Community Health Improvement, looking at ways in which BJC could support health beyond the walls of hospitals and doctors' offices, which was one of the messages of For the Sake of All, that health doesn't happen in hospitals. It doesn't happen in doctors' offices principally. It happens in community. So this vice presidency for community health improvement was created, and I became that inaugural vice president for community health improvement.
Mm-hmm. And the last time you were on the show, talking with the former host, Sarah Fensky, you were talking about coming into that position. One of the things that you all talked about was economics. And economics is a huge part of the report, the original report, about things that exist, things that needed to change. We talked earlier this week about the Black community that was displaced from Clayton. And again, going back to Clayton, that 18-year difference in life expectancy. And one of the most eye-opening points that was made in For the Sake of All was that disparity, that by living less than 10 miles away, that you could live that much longer. It seems like everyone, took that data. They really held on tight to that particular statistic. How much, though, has been done to improve that? And where does economic considerations come into play with this, particularly when it comes to education and, sort of the primary level of health?
Well, education is and continues to be one of the strongest and most consistent predictors of health outcome that we have. It's closely tied to life expectancy as well, and for multiple reasons, not just because we know that people with higher levels of education make higher incomes or more likely to be in jobs that have benefits like health insurance, but also because education gives you access to information. It gives you the ability to navigate systems effectively for yourself and for your family, to navigate the community more effectively. So education is fundamental. But we also know that people having the economic wherewithal, both in terms of income and wealth, is tightly related and associated with better health outcomes and better life outcomes. Mm-hmm. And what we know is that we're in a moment of I wouldn't say unprecedented, but certainly significant income inequality as a nation, and that certainly impacts us as a local region. And layered on top of that is the history and legacy of race and the ways in which people have been systematically excluded from economic opportunity. Mm-hmm. And part of the thrust of the title For the Sake of All is that this has impact beyond just the Black community. This has an impact on our competitiveness, our vibrancy as a region. When we leave 30% of the population outside of the economic mainstream, we're not going to grow as a region. And that's one of our main areas of emphasis at the James S. McDonnell Foundation.
Mm-hmm. One of the things that I had noted in the introduction was that For the Sake of All was eye-opening to some. Eyes may be open or closed by volition, some by sort of natural ignorance or unawareness, but that it was also affirming for some people. Talk with me about how For the Sake of All affirmed what so many people had been experiencing.
One of the prime examples of that for me is, I told you we were trying to make this narrative accessible to people. And we told the story of a fictitious little girl named Jasmine, and told her story with the resources and the supports and the context in place and without. And Jasmine was a grayscale stick figure on a page, but I can't tell you how many people said that is my story. Not having access to high quality childcare, not having the schools that I need for my children or myself to succeed, not having access to paid leave and the benefits that are so crucial to survival. That was my story. And there are so many things about this report that I did not expect to resonate in the way that they did. Jasmine is one of them. Mm-hmm. So that was affirming to people. But it also helped people to have data to back up what their lived experience, their anecdotal lived experience was telling them very clearly. Mm-hmm. It helped to have that narrative told in a way, and to have, the imprimatur of a Washington University and a St. Louis University validate what was people's lived experience.
Mm-hmm. Credibility.
Yes.
Yeah. So, Jason, you have a PhD in clinical psychology. And after your work at WashU, we just talked about the time that you spent at BJC leading community health efforts, putting together a plan with actual steps that needed to be followed up on. And you are now at the helm of the 9th largest foundation in St. Louis. So you are President Purnell now. Did you leave BJC for the James S. McDonnell Foundation to address the economic issues highlighted in For the Sake of All more directly?
I should say that I was not looking for this position. I was quite happy chugging along at BJC and very proud of the work that we were doing, particularly around BJC's role as an anchor institution and addressing things like hiring and purchasing and impact investment through the health system, which I'm very proud of the work that continues at BJC that we laid the foundation for. I will say there is a very significant through line and a consistency to the things that I care about. And this was an opportunity to place some resources behind the work. I tell people when we did this report, there was no implementation of the recommendations. There were no resources set aside for that. And I'd say similarly, there weren't any for the Ferguson Commission either. There were recommendations without resource. And part of what we're trying to address now is how do we organize the resources, not just of the James S. McDonnell Foundation, but funders and actors throughout the region to put some real infrastructure and some sophistication to actualizing equity and not just talking about it.
Right. So who is the foundation supporting right now?
We have a number of grantees. We're very excited about Invest STL is one of them. We're very interested in their Rooted initiative, which is actually putting money in the pockets of members of the West End neighborhood for them to invest in their futures, whether that's through a business or investing in the market or home repair or home purchase. And also some of the other innovative things they're doing around community wealth building and making sure that people have access to assets. We're also excited about supporting a new home repair network that's partnering with Legal Services of Eastern Missouri to make sure that people have clear title to their homes so that they can access home repair resources, but also so that they're doing some pretty basic estate planning so that asset, which is usually the largest asset for most Americans, can be transferred to the next generation.
Right.
Those are just a couple of examples of who we're funding.
Mm-hmm. So we're not going to have enough time to get into everything, even if we had the entire hour. But is there something, Jason, that I have not asked, that others have not been asking, that you really feel needs to be broached so that we're not having the same conversation in 10 years that we've just had now?
I think we've got to get more facile as a region at walking and chewing gum. I think that those of us who care about equity have to be in conversation with those of us who care about economic growth. And those of us who care about economic growth have to speak with the people who care about equity. Mm-hmm. We're not going to advance as a region, as I said, without all of us advancing together. Population loss has been in the news of late, and we're not going to arrest that trend unless we make the value proposition of being in St. Louis a much more attractive one. Mm-hmm. And that means for the people who are here and the people who will come here. So it's about investing in ways that allow people to participate in our regional economy and do that with some sophistication and fidelity.
Jason, thank you so much for talking with us.
Thank you.
This episode was produced by Maya Norfleet.
Our audio engineer is Aaron Dorr. This podcast was mixed and edited by Aaron.
Our executive producer is Alex Hoyer.
St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations, and leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thank you.
St. Louis Public Radio is a member-supported service of the University of Missouri St. Louis.
The Gateway brings you the day's news from the St. Louis region and across Missouri. It also includes stories from the Illinois side of the river and our Metro East reporter, Will Bauer.
In Alton, in Belleville, in East St. Louis, in Edwardsville, in Cahokia Heights, at Scott Air Force Base, I'm Will Bauer. St. Louis Public Radio.
Listen to reports from Will and all of our journalists weekdays on The Gateway, on the STLPR app, and wherever you get podcasts.